what is most startling for me is we are in 21st century and we are still not able to diagnose 40% of those patients who have active TB. That is a shame. OpenTB challenge is a challenge for Eterna Players to come up with a molecule that would allow us to detect the 3 genes that we've identified for diagnosis of active TB in a whole blood, so that we could transfer it to a paper-based device for use in clinical practice. Since the discovery and publication of the 3-gene signature, a number of studies have come out showing that the 3-gene signature is working as it was predicted and described in the very first paper. One of the other very exciting preliminary development is that we've been able to show in one data set that we are able to predict who is going to have active TB disease given that they have a latent infection about 6 months prior. If this is further validated, then we can start treating people 6 months before they become infectious and start breaking the cycle of infection, which is what is required to stop TB. Eterna Players have been an integral part of this process, and the design of OpenTB molecule in the first 3 rounds has actually shown that it is possible to convert this 3-gene test into a paper-based test, which would be cost-effective, can be used in resource-poor areas, and in that regard, I have to thank the Eterna Players for being part of this global health problem, coming together and finding a solution in such a record amount of time. For TB, I am really looking forward to seeing an OpenTB molecule translated into clinical practice. But this project is bigger than just TB. What I hope to achieve, or where this project would go, is into other infectious disease diagnosis. Influenza, malaria, dengue. These are again infectious diseases on the same scale as tuberculosis. We have been working on analyzing the data that exists for identifying disease signatures for diagnosis of these infectious diseases, and I'm hoping that we will continue the engagement from Eterna Players. So thank you very much for all the work that you guys did.